What's up, MedGirl Squad? It's future Dr. Rezi, and if you don't know me, hi, my name is Resume Uye, and I am the author and illustrator of a children's book called Girls for Medicine, right up there. And this is a book that's meant to encourage kids, especially Black and brown girls, to consider careers in healthcare. Why? Because representation matters. So I'm so excited to welcome once again another physician today, and her name is Dr. Ashley Roxanne, but you can also call her Dr. Rox. Woo! Hello.
Thank you so much for having me. I'm so excited to talk about my superpower in medicine.
What is a fun fact about you?
I really like to travel. I've been to 6 of the 7 continents, and I'm trying to get to all 7. So I have one more to go, which is, of course, Antarctica.
What has been your favorite place so far?
Thailand was wonderful. I went with my family. And then also the British and US Virgin Islands is just very beautiful. Both of those places I really enjoy because of the beauty and the culture, especially in Thailand. So that's what I love about travel. You get to learn about other people, their food, and what they do there, and their language. It's very beautiful.
That is so great. Thank you for sharing that. I hope I can go there one day. Hopefully when, the world opens up again, but either way, that's exciting. So what is your favorite food of all time?
I like something called gumbo, and it's a Creole and Cajun type dish. You put in like chicken and sausage and crab and shrimp and all these different meats into the same stew and put it over rice, and you eat it as a meal. So I love it because my family.
So good.
It's so good.
And we know you like to travel. What else do you like to do for fun?
So I also really like sports.
Ooh, okay.
Yes, I love football, to be exact. Played soccer when I was younger. Loved soccer.
So when you were a kid, what was it that you wanted to be when you grew up?
It's so funny because I didn't actually want to be a doctor, but I did want to do something in science. So
okay.
I went through these different phases. First, I wanted to be the first woman in the NFL.
Wow.
Then when I was 8 or 9, I said I want to be an architect because the creativity and the science and math, but you don't really talk to a lot of people. You sit in your studio a lot and you create. So, and I like to talk. Then I said maybe a marine biologist because you talk to a lot of people on your team.
Mm-hmm.
You work with animals in their environment and find solutions. Then I said I was gonna be a pharmacist.
Okay.
I realized with pharmacy, you don't talk to people over time. Once I became a freshman in college, I said, well, maybe I'll just be a doctor. Because you get that pharmacology aspect, but you also get the patient interaction. And here I am. I'm so happy to do that.
Yeah, I just love the whole job shopping that you were doing in the beginning. Architect, no. Marine biologist, no. Pharmacist, all of these things, that's just crazy. But that's kind of how every kid's mind would be. I'm so glad that you shared that, because I think what I want kids to know is that it's okay if you weren't already thinking you wanted to be a doctor from the very beginning, and you don't really know too much about a certain job until you actually go to a space where you're with other people who are interested in that job, or you're being taught by those people doing that job that you're interested in. In elementary school, what was your favorite class? I know you said you liked science, but was that your favorite class?
I've always loved math. Always loved math. I don't know if it was because I was good at it or it was really actually the subject, but I always loved math because I used to be able to finish the assignments quickly and just, versus like history, I didn't like. I think that I didn't like history because you had to like memorize dates, memorize names, and I'm more of a big picture person, and so I didn't really memorize those people's names and the dates and why this happened and why that didn't happen. Versus math, I was like, well, there's one formula, put in the formula, and that's it. There's no apps. Or there's no like figuring it out.
It's very straightforward. It's right or it's wrong. What made you become a physician?
I want to truly help people, and I love science. And so, as you see, I kind of went through the different phases of figuring out how I could help people, and also do science and math and those types of disciplines and subjects. And medicine just felt right, especially once I started shadowing. I was like, wow, we really get to help people every day. It just felt right to me. I think that's something too, that do you feel happy and passionate when you do your job?
Yeah. Then you said a word, shadow. What does that mean?
Yeah, so shadowing is basically when you go to someone's job and see what they do every day, or sometimes they can just talk to you in detail and tell you a lot about their job so you can understand. And so shadowing helped me because I felt like I got to see every day what a doctor did, or even what the pharmacist did.
Yeah, that's a very, very important thing that everyone should try to do for any job, honestly. If there's a job that you really like someone doing and they're doing it the way you want to do it, sometimes people just like to ask, hey, can I just see what your day-to-day life is? And it's not just a word that you use when you're trying to, see what a doctor does every day. It's for any job, honestly. So thank you for defining that for us. And what kind of physician are you?
Yes, so I right now am a resident physician, which means that I'm training, but when I graduate in about a year or so, I will be a family medicine doctor. And so a family medicine doctor basically sees all different ages, and that's their superpower, in that they know a little bit about each different age group. So when a woman is pregnant, when they have the baby, when they're about the age of elementary students, high school students, adults, and older people. They see all of those, and so they don't really have one superpower. They get to see all the different strengths of all of those different ages. And that's why I like it, because I get to see all of the ages and get to help them with their health throughout their whole lives if they want me to.
That is so cool. There's different physicians that focus on certain age groups. So if you're in elementary or middle, or you go to high school, you are most often going to be seeing a doctor called a pediatrician, and they care for your age group. Or you might see someone that is focused on just older people. And so like your mom and dad. So there's doctors that are focused on internal medicine, for example. Or if there's people who are a lot older than your parents, like your grandma or your grandpa or your great grandma or grandpa, they are known as geriatric doctors. Well, those are a lot of terms, but I'm just saying each of these doctors has a special power for every group, but she has the power to see all age groups. So that's really, really cool. And I can imagine that you could see anything, honestly, right?
Yes, I see a lot of different things every day. Of course, you see a lot of people with high blood pressure, and a lot of people who are trying to have children. But a lot of times we do checkups, but really anything can come into the office, because people come to their doctor when they're sick. And they could be sick with anything. And so I've seen some cool cases. And sometimes it's my same patients, and we're just helping them with the diseases they've had for a long time.
If any of you have my book, there's a girl in that book named Ava. and she wants to be a physician, remember? And it said the person who has the MD or DO at the end of their name. And I'm sure you guys are wondering, why is there two different ones? Dr. Rox is not an MD, but she's a DO. Dr. Rox, what is the difference between MD and DO?
Yes, I love talking about what we call osteopathic medicine because I am a DO doctor. And so basically there's two types of doctors in the US. There's MD that a lot of people know, and then there's DO, which is about 20% of medical students right now. And so DOs across the nation do the same thing as their MD doctors, but they also practice on the body by basically treating the spine and the muscles that you have throughout your body in order to make the body heal itself better as a unit. And so we believe in preventative medicine, or medicine that's like the whole body, and we do a lot to do with the spine and the muscles to treat the body and have it work together to heal the body. MDs also do these things, but we have special training for 300 hours actually that we do at our school. So there's no difference in the way that a MD or a DO gives medicine or does surgery, but we just also sometimes do treatments on the body called OMM.
So in case you see anybody that has MD or then you see another person that says DO, then that's just your hint to say, oh, physician, got it. They're both doctors. So that's really all you need to know. And so if there's any of you guys, like say high schoolers that are watching this, just know that both of those options are really great options, and they're just going to prepare you to become a physician regardless. Thank you so much for talking about that. So now if someone wanted to become a physician, what do they have to do? What do you have to do to become a doctor, a physician?
Yes, so you guys will go through elementary, middle school, then high school, and graduate from high school. And then once you graduate from high school, which you will, you'll choose a college and then go to college for 4 years. And you'll get a degree in whichever you want, but you have to take specific classes to go to medical school. And so some of those classes are like chemistry, biology, and physics, all these classes that have to do with the sciences. And then after you take those different classes, then you will apply to medical school. And once you're accepted, you will go on and finish 4 years of medical school. And then once you graduate from medical school, you're a doctor.
Woo! Yeah. So it's definitely going to take some time for you to get to becoming a doctor, but all of that is just to make sure that you know everything you need to know, as much as you need to know, to make sure you can care for somebody that doesn't know anything about what's going on with their body. You are that person that can be like, hey, I know what's going on with your body, or I've learned a lot about the body, so we can figure out what could be happening and find a way to make you feel better again. And I think that kind of ability, it does take time. And I've just been saying that for a while for all of the different healthcare professionals that you guys have seen on this channel so far. So just know, yes, it takes time, but it's definitely worth the time for sure. But thank you so much, Dr. Rox, for that explanation. Yeah. So, and if you guys are watching this right now in elementary, you guys are ahead. You are ahead of a lot of people. What are those qualities and characteristics in someone that makes them an awesome healthcare professional? In other words, how can one be a girl for medicine like you?
Have a passion for helping others. I also think that a good physician is also a leader. They lead a team of nurses, they lead a team of sometimes other doctors. I have a boss as a training doctor, as a resident, and they help me learn more about being a doctor. And then I also think that they have to like learning, and so
Mm-hmm.
as a doctor, you are a lifelong learner.
Yep.
Every year there's tests that we have to take. You keep learning more and more because the medicine and body and the way that our health is affected is always changing every second. Even now, we have a new type of virus, unfortunately, in the world. So that shows you that everything is changing, and so you have to keep learning.
Yep.
That's what I actually like about medicine, though, is that you are always learning something.
Learning something new, definitely. That's why I wanted to go into medicine, because I think it's gonna always keep me on my toes and challenge me to learn new things, while also trying to see how that connects with the things that I learned in the past as well. You're gonna be a lifelong learner for sure. So thank you so much for sharing that. And now I do want to ask you a question for the little girls watching this who look like us. And my question for you is, what advice would you give to a little girl who looks like you and she wants to be a girl for medicine? She wants to be a doctor like you.
So just don't give up. I always say, if you fall down 10 times and you stand up 11 times, then you just keep going. There are going to be people who say bad things. There are going to be times when you don't always get what you want. There are going to be different things that you thought you could do and they might not work out. And that is okay. We want to be perfect human, and there is no perfect human. I myself have been through things and I just kept going. And that doesn't make them easy things. Mm-hmm. It was hard to go through whatever, but it turned out okay in the end. Mm-hmm. For help, figure out what works for you, not just what everyone else does.
Thank you. And girls, not just for all of you guys that look like us, but just every girl that's watching, every kid that's watching, that what she just said is not about just if you want to be a doctor and stuff, or if you want to be a healthcare professional. It's something that you need to know about for your life overall. It's like, don't ever give up. Do not compare yourself to other people. You are unique in your own way. You are going to be called to do different things, and you guys are going to do it excellently in your own special way. And there's room for you in medicine. There's room for you in whatever job you want to go for. Even if you haven't seen anyone doing the thing that you're doing, that doesn't mean you can't do it yourself. Maybe the world is just waiting for you to do it so that someone else after you will see that, oh wow, she's doing what I want to do. Yeah, let me follow what she's doing. You're going to start a brand new path for someone else. Know that we are here to support you on whatever you decide to do. We just want to make sure you know what options are out there, because we definitely know that healthcare needs girls, kids like you guys. And for all of the girls who look like us, healthcare definitely needs girls like you. So don't ever let anyone tell you that's not true. Okay? Dr. Rox, we celebrate you for just doing what you do and paving the way for girls like me and little girls that are watching this that just want to be where you are at. So thank you guys so much for watching this video. This is just one of many videos coming in the future. Make sure you subscribe to this channel and turn on your notifications, and you will be the first to know when we have a new video up. And make sure you follow us on Instagram, that Girls for Medicine, where I'm going to be hosting a lot of giveaways and you get to see all the other silly things that I do. I just got into TikTok, so bear with me. If you would like a copy of Girls for Medicine, all you got to do is go to girlsformedicine.com and place your order for this purchase, and you will get a book that is signed by me. So that's the end of the video. MedGirl Squad!
MedGirl Squad!
Thank you so much. Bye.